talk is on chiropractic and science. So what is scientific healthcare, and are you receiving it? So I want to thank everybody for taking some time out of their lives, a half hour or so, to learn and understand some things about health, about science, and about how science applies to healthcare. And as some of you know, and this is going to be repetitive for some, but my goal is to make Lincoln a healthier, more educated place. Okay, that's my goal, all right? So I'm going to ask you first, what is science? Is science something we can just like place on the counter? What is it?
It's the study of our environment.
Okay, it can be, that's part of science.
That's what chemistry, biology, and physics is.
But what is it? What makes something scientific? Is science static? Does it just stay the same?
No.
Okay. Can anybody give me an example of scientific principles, science that has changed over the years, and we found maybe certain things weren't the way we thought they were?
Astronomy.
What to eat, when to eat, which foods.
Yeah.
They're bad, now they're bad. No, they're bad, no, they're good.
Okay. So dietary issues.
Yes.
Okay.
We
Sarah.
learned that all the organs of humans and how they work.
Okay.
Because we used to not know that.
Okay. And we're learning more about how they work. So I'm going to put you on the spot. Okay. Can you give me an organ in the body that it's a little past your age, but 20 years ago, they did not know this about how it works, and they know a lot more now. Can you give me an organ and how and what they discovered?
Pancreas.
Okay. What they discovered about the pancreas?
Sorry, I'm trying to think of what the pancreas is.
Okay. I think you're guessing. Okay. It's okay. It's all right. It's all right to do that. Can anybody think of an organ in the body that 25 years ago, let's go back to like 1998, 1999, we didn't know near what we know about it now. And it has a huge impact on the body. Anybody?
Spinal cord.
Well, we're learning more about that, that's for sure. I was going to say the gut.
Yeah.
The gut, okay? What do we know about the gut now that we didn't ever really understand before?
It affects everything.
Yeah,
The
it affects,
status, the
it's connected to autoimmune disease. We know that. It's connected to how our brain works through the vagus nerve, okay? It's connected, it houses almost our entire immune system.
Yeah, nobody knew about leaky gut syndrome.
Good.
Exactly.
Yeah, that's right,
That's a
Terry.
big one.
Yeah, leaky gut.
Yeah.
Now, I knew about that, and I was taught that by a chiropractor in the mid-90s who practiced in Missouri, little town in Missouri, taught me about leaky gut. I just didn't have the grasp on it that I do now. I didn't know how to work with it back then. But he understood it back then. He understood food intolerances, he understood leaky gut. But the vast majority of people didn't. Now we do understand it. We understand how that affects our body. So it's an ever-evolving thing. So the other thing I wanted to say about gut issues and the evolving is what is this whole thing with antibiotics. So if you go back to the 70s and 80s, okay, how are antibiotics prescribed?
Randomly.
Almost like candy.
Yes.
Okay, remember in the 70s and 80s when, and I'm not criticizing physicians because they didn't know, okay, they were just doing the best they could, but they take somebody with skin issues and put them on antibiotics for years. And then we realize now it has destroyed their gut, caused leaky gut, caused autoimmune disease, caused all kinds of problems that we didn't even know. We had no idea back then. We had no idea about the probiotics and how important the gut bacteria were. And so they passed out, I remember that, pass out antibiotics like crazy. Keep them on people on antibiotics for years.
Like aspirin,
And it destroyed their gut, it caused all kinds of problems later on in life. Okay? They didn't know that. Okay? So now they don't do that nearly like they did because we know different now because science is evolving. Now, you're an engineer. Is science evolving in engineering?
Oh, sure.
Yeah.
All the time.
Absolutely it is, yeah. We're always learning new things, right? So the advent of evidence-based healthcare was a paradigm shift. Now, this is a slide some of you probably seen before at another talk I do. It was designed to provide a scientific foundation for all health disciplines. It started in about 1991. The validity of this model depends on reliable data from clinical trials, most of which are conducted by the pharmaceutical industry and reported in the names of senior academics. So we're going to talk about clinical trials here in a minute, but most of the clinical trials that are performed are done by the pharmaceutical industry, which are for-profit organizations. So the integrity of science in an open democratic society requires that scientists have to be open-minded. They cannot cling to their cherished hypotheses, even in the face that maybe the evidence isn't there. Can anybody think of something really recent in the past several years where we were told that something was very scientific and very sure, and it turned out not to be that way at all?
COVID.
The COVID vaccine, yeah, COVID vaccine was not like we were told. Lots of problems with that vaccine, lots and lots of problems, okay?
Boom.
This slide just shows, and this is from the Illusion of Evidence-Based Medicine, which is from the British Medical Journal a couple of years ago. To show that the drug industry has misrepresented their clinical trials. And they said in this article, unless this is corrected, evidence-based medicine is an illusion, unless they release the information in their studies. So this is about when corporate financial interests get involved in research, science sometimes goes out the window. So Ian Harris, he wrote a book that I have called Surgery, the Ultimate Placebo. He's an orthopedic surgeon. I read his book. He's not a great fan of natural medicine, I'll just tell you that, but he's got a lot of good ideas, okay? So he said there's two primary types of clinical studies. There's observational studies. So an observational study can help researchers come up with a hypothesis that can be tested, okay? So can anybody in here give me an example of something, of an observational study or an observation that could be tested or that has been tested? Or what's something that we consider pretty observational, that we can study observationally? Anybody? I mean, anybody that's been in my talks, I didn't know this. How about diet?
Yeah, I was gonna say food.
I mean, so we can observe, one of the things we can observe, and this has been talked about a lot, is that people that eat huge amounts of sugar, they have a very high sugar diet, tend to be a lot fatter than other people, okay? That's an observation, okay? Now, what's happened is there's been some clinical trials that actually prove that, okay? So that's an observational study. Can anybody think of another one, another observational study? Another observation that we've thought about? Nobody. Okay, all right. So let's look at clinical trials. Clinical trials are often, they're tightly controlled experiments involving an intervention. Could be a pharmaceutical, but not necessarily. So if we look at a double-blinded clinical trial, this is the gold standard in scientific, The only way you can do double-blinded study really is with a pharmaceutical. You can do it with nutritional supplements, but primarily pharmaceuticals. So neither the researcher or the person you're giving it to knows who's getting it. Now, blinded study is a researcher knows who's receiving the real drug or the intervention, but the person doesn't, okay? So you can do blinded studies with chiropractic. You know, you can give sham adjustments, and I will talk about those in a minute, where people don't get a real adjustment, some people get a real adjustment, then you can look at the outcomes of that. That would be a blinded study.
So what's the point of a double-blinded study if either one, the patient or the researcher don't know what's going on?
Because there's no room for bias. And subtle biases kick in when a lot of times, not always, when one person knows what's going on, biases can alter the study. That's the reason. And when you have a double-blinded study, when nobody knows what's going on, well, they'll ultimately know. Biases can't kick in. So if you're giving somebody a drug, you don't know if it's a drug or a placebo, the patient doesn't know, then you can't imagine things. You can't imagine people are getting better. The patient can't imagine. Now, the problem with double-blinded studies with pharmaceuticals is that patients start getting side effects, and they know when they're getting the drug. That happens all the time. Okay.
Yeah.
So it's pretty hard to double-blind it. So let's talk about the first chiropractic study that's ever done. This was published in the Medical Times Journal, 1921. Henry Windsor was a medical doctor from Philadelphia who was intrigued by patients returning to health using chiropractic and osteopathic care. So he planned an interesting experiment. He was going to do autopsies on animals and humans to see if there's a relationship between the health of the spine and the health of organs in these people. So he was at the University of Pennsylvania, which is, an Ivy League school. He dissected 75 people, humans, 22 cat cadavers, and he found 221 diseased organs. Now, what he found was 100% correlation between minor curves of the spine and diseased organs. So, if the curve was at the top of the spine, like the top of the thoracic spine right here, then the heart and lungs were affected, okay? If he found out it was the middle of the spine, depending on where it was, the stomach, the gallbladder were affected. If it was towards the lower part of the spine, his kidney disease, prostate, and bladder were affected. Like, for example, if we looked at prostate and bladder, of 8 cases, 7 were from the upper lumbar, 1 from the lower thoracic. In the stomach, all 9 stomach diseases had mid-thoracic involvement. So he found this direct correlation. Liver disease, all 13 cases had misalignments in the mid-thoracic area. So we know that the nerve supply, the stomach, the gallbladder, the pancreas and liver all comes from the mid-thoracic spine. Heart and lungs from the upper thoracic spine. And he found this perfect correlation between people that had curves in their spine and diseased organs. Now, here's some of the findings in his study. It was rare to find an organ disease which was not supplied by the same sympathetic nerves as the vertebra in the curve. So if you have that curve in the spine, there's also a diseased organ. Many of the organs showed acute disease, while the deformed vertebrae were older in nature and proved that the curves preceded the organ disease. So the curves, the problems in the spine started first, and then the organ problems started later. So what does that tell you?
It's a direct correlation.
Direct correlation, but what else does it tell you? You have a problem in your spine.
You need realignment
For a long time, and you may not even know it, and it's causing your organs to malfunction over time. So disease appeared to precede old age and then cause it. The spine becomes stiff and old age follows. Therefore, we can say a man is as old as his spine. Yes, Randy?
So can a leaky gut, a spine issue cause your leaky gut issues too?
Can definitely contribute to it, yes. It could cause it, but certainly contribute to it, yes. So, chiropractic adjustments versus disc surgery. This was in the Journal of Manipulative and Physiological Therapeutics, October 2010. Purpose of the study was to compare the clinical efficacy of chiropractic adjustments against disc surgery in patients with sciatica, secondary to lumbar disc herniation. This is a randomized clinical trial. So this is the first study that ever compared surgery against chiropractic for disc issues and sciatic. Is also the first study to report on chiropractic manipulation effects on a group of patients failing other medical management interventions. So after failing 3 months of traditional conservative care, which would be, when we say traditional, meaning medical conservative care, analgesics, painkillers, lifestyle modifications, physiotherapy, massage, and/or acupuncture, 40 patients were randomized, meaning just picked out randomly, either surgical discectomy or chiropractic manipulation. All of the patients were deemed surgical cases by medicine, by the medical community. So these patients were assessed at 3 months, 6 months, 12 months, 24 months, weeks, and 52 weeks after treatment was initiated. Okay? After 12 weeks, 60% of the 20 manipulation patients demonstrated clear improvement in outcomes and continued to complete the 52-week follow-up period. Of those who failed spinal manipulation treatment, subsequent surgical intervention provided excellent outcomes. What does that tell you right there? Anybody? What does that sentence say?
Good chiropractic care can relieve most of the outcomes without surgery.
You're warm. You're warm. It says that even when a patient had to have surgery, if the surgery was preceded by chiropractic care, the outcomes were better. That's what that says. Okay, pretty interesting. Here's a University of Iowa study on Medicare patients, 2014, demonstrating the following, that seniors under chiropractic care had fewer functional limitations, less difficulty engaging in activities such as lifting and walking, lower number of doctor visits and hospitalizations. They concluded that chiropractic had a protective effect, safeguarding them against physical deterioration. So here's another one, chiropractic and pregnancy. There's a study where they looked at 115 pregnant women. They were experiencing pain in their back or their pelvic area. They hadn't engaged, they hadn't been a chiropractor in the previous 3 months. So 1 week into treatment, 52% noticed a reduction in pain. 1 month into treatment, 70% indicated a reduced pain. 3 months, 85% were happy with the results. 6 months, 90% noticed a reduction in pain. 2 other studies on chiropractic and pregnancy revealed that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic care. So it actually enhances the delivery process. Why would that be? What would cause that? Anybody? Why would a pregnant woman under chiropractic care have a shorter delivery? Nobody knows?
Would it improve the nervous system? Chiropractic care improve the nervous system and the blood flow
Okay,
to the pelvis?
very good. That is
I hear
definitely a reason. So yeah. So does the uterus have a nerve supply?
Hell yeah.
Yeah, it does.
Big,
Of course
big.
it does.
Yeah.
So if you improve the nerve supply of the uterus, it can function better. Okay, that's one thing. What would be another reason? What would be another reason that a delivery would be easier and better for pregnant women under chiropractic care? Besides the nerve supply, very good, very good. What would be the other reason? This is a little harder question, but some of you, if you think about it, could get it. Okay, I'll tell you the answer. So if the pelvis sits like this, so the uterus is sitting on top, if the pelvis is torqued like this, okay, and stretching the uterus, all right? So if you align that, don't you think that the uterus would work better? The baby would be able to come through the birth canal easier if it's not torqued? Yeah, of course it would. So that would be the other reason. So there's two reasons for that. Okay, Annals of Internal Medicine, very well-respected medical journal. 192 patients with back and related leg pain. Half were given chiropractic care with home exercises and advice. Half were given only home exercises and advice. The chiropractic patients were given 20 visits over 12 weeks. At 12 weeks, the chiropractic group had less back pain, less disability, better overall improvement, and patient satisfaction. At 1 year, the patients who received chiropractic maintained their overall improvement and satisfaction. So here's two recent studies, one in Canada and one in Tennessee, showed that the average chiropractic care was 40% less costly than medical care, and patients were more satisfied. Again, that was Journal of Manipulative and Physiological Therapeutics 2010. Okay? Here's one, Archives of Physical Medicine and Rehabilitation. 40 men diagnosed with degenerative disc disease, which is probably, half the people over 50 at least have degenerative disc disease, maybe more. Half were treated with chiropractic adjustments, half with a placebo adjustment. Okay, so they didn't really adjust them, but they pretended like it. The results from patients who received a single adjustment reported less pain, had increased spinal mobility, better hip flexion, had significant measurable increase in height. So they even measured their height in that one. Here's chiropractic in the workplace. Here's another study. 2 studies in the Journal of Occupational and Environmental Medicine indicated the following. 17% of U.S. workers have absenteeism as a result of musculoskeletal conditions. So, and you guys probably know this, but I'll just say it anyway. Number one cause of disability in the workplace is back pain, lower back pain. Number one cause, okay? So, chiropractic offered on site at the workplace showed improvement in both pain and functional status, lowering of overall health costs. Workers used fewer drugs and had less physician visits, reduced work absenteeism, increased employee productivity. You think based on this study that everybody would want a chiropractor, if you had a factory, but there's some government problems with that because a chiropractor is considered a primary health care provider. If you have a chiropractor on staff, you have patients seeing that chiropractor, and you have to report that to OSHA, and then your administrative costs go up. Somebody at a corporation here in town was telling me that it's government intervention and rules and regulations that prevent some of this. What about cervical disc herniation and neck pain radiating into the arm? This is 50 patients with confirmed cervical disc herniation. They had moderate to severe arm pain. They're given chiropractic adjustments at 2 to 4 times per week. At 2 weeks of care, about 55% were improved. 4 weeks of care, almost 70% were improved. And then at 3 months of care, almost 86% were significant improved. They were 2 to 3 times superior to published study of patients receiving a cervical nerve block with steroids. So here's another interesting study. This is so far we've just primarily talked about pain. Changes in biochemical markers after spinal manipulation. So this was a study that was done, and they looked at what effects does chiropractic care have on your neurochemicals and your hormones. So they found out that they looked at neurotensin, oxytocin, and cortisol. These biochemicals are known to suppress pain as well as having other physiological effects. So what they found, I don't know why I don't have another slide for this, that this study that they did affected those neurochemicals. Now this study in Medical Science Monitor in February 2016, what happens when an individual loses their cervical curve? Okay, and what they found was disruptive spinal biomechanics triggering degenerative process causes neck pain, upper thoracic pain, headaches, shoulder pain, just a poor quality of life. Loss of cervical curve also causes a decreased blood flow to the brain due to changes in the vertebral artery. So when you lose a curve in your neck, you change blood flow to the brain along with all these other things. So here's a loss of curve. There's what a curve's supposed to look like. There's a loss of curve. A whiplash injury will do that to a neck. Okay, and if you look at and what this study showed is when you bring the curve back in, it increases blood flow back to the brain. So chiropractic and migraines. This is a 2015 study. 3 groups of migraine sufferers were divided into 3 groups. 1 group received chiropractic adjustment and drugs. 1 group received a sham adjustment and drugs. 1 group received drugs only. The study lasted 6 months. After 6 months, the results of the study were as follows. The manipulation plus drug group were able to reduce their drugs by 80%. Their migraines were reduced by 97%. Their functional disability was reduced by 100%. What is functional disability? When I say that functional disability was reduced by 100%, what do they mean there? Anybody? Yeah.
Something preventing you from just performing daily tasks.
Yeah, right. From working, doing things. Yeah. So what they found was that people that were under the manipulation plus drug group were able to function pretty normally again. Okay, which is pretty important. The meds plus sham manipulation group reduced the drugs by 68%. Their migraines were reduced by 17%. They had a 33% reduction in functional disability. We're going to get back to that in a minute. That's pretty interesting. The meds only group had no reduction in medication after 6 months, but only a 1% reduction in migraine headaches, and a 0% reduction in functional disability. So, what's with this? What's with that? They got a sham adjustment, and they were able to reduce their drugs by 68%. They got sham manipulation. Migraines were reduced by 17%. What's with that? Why? Anybody? Sarah?
Migraines can cause like anxiety, and when you have anxiety, it can help like make your migraine worse. And so, if you think you're getting helped, it can reduce some of your anxiety, which can also kind of help your migraine.
That's pretty good. Placebo effect, kind of, right? Yeah. So that's one. I think that is certainly going on there, but there's something else. Randy?
I'm going to take a stab at this. Sham manipulation.
What?
A sham manipulation.
Sham manipulation. Okay, so they weren't actually giving an adjustment. It was fake.
Right.
Okay.
But the patient thought it was real.
Patient thought it was real. Okay, so that's the placebo effect.
That's it right there.
Okay, but there's something else going on here.
There's something else.
Anybody else?
Okay.
How about just the fact that human being touched by another person where you, that you think cares about them
Manipulation.
produces a response in the body that's positive?
Sure.
Okay? Yeah.
Sure.
So that's also going on there. Okay? So here's Heidi Habit. She's one of the top researchers in the world on chiropractic and what an adjustment does. She said spinal subluxations causes abnormal feedback to the brain, which causes abnormal brain function and abnormal feedback to the body. This causes poor control of the spine and body, leading to pain and loss of function, including balance, reaction times, depth perception, increase in muscle fatigue, and loss of muscle strength in legs. So basically, it talks about hand-eye coordination, your balance, okay? So as we get older, is balance important?
Yeah.
Really
Of course it
important, okay?
More important.
And so she found that when somebody's subluxated, they don't balance nearly as well. They don't have the depth perception. According to Dr. Habit, the most interesting thing that has come from her research is that chiropractic care, adjusting the spine to restore spinal function, actually changes what goes on in the brain. It changes brain function. So I mean, even if you don't get a lot of pain relief, you get adjusted, it's actually affecting the brain in a very positive way. And her research has absolutely proved this beyond a shadow of a doubt. She found that a single chiropractic adjustment positively alters all sorts of processing in the brain and central nervous system, including how the brain controls muscles, how the brain increases the strength of the muscles, how the brain reduces muscle fatigue, and immune and endocrine function. So last thing I'm going to talk about is NNT and NNH. Has anybody ever heard of NNT, number needed to treat? Ever you heard this concept? Yeah, you have if you've seen
I've
this
been here
talk
before, yeah.
right? Okay, NNT is a huge concept in medicine in the pharmaceutical industry. It's number needed to treat. What that means, NNT, is how many people do we need to give a pharmaceutical to before one person benefits? That's called NNT, number needed to treat. NNH is how many people, when they get this pharmaceutical, how many people taking this drug will we give it to where we harm one person? NNH. These are huge concepts in pharmaceutical research. Now, the average person hasn't heard of them, but it's really important. So let's look at, okay, this is what I just told you here. Number NNH, how many people need to be treated before one person is harmed? Okay, so if we look at statin drugs, NNT, okay, this is available online, a lot of this. So statin drugs, if you treat 103 people over 5 years, one person benefits. Okay, that should shock you. Okay, that's the NNT of statin drugs. Antibiotics for upper respiratory infection. None were helped for infection. 1 in 6 were helped for cough. Okay, coronary bypass for preventing death in 10 years. 1 in 25 surgeries, one person was really benefited. Okay, that's the NNT of coronary bypass surgery. So let's look at aspirin to prevent heart attack. 2,000 people have to take aspirin on a regular basis before one heart attack is prevented. Okay, pretty shocking. Okay, but these figures